I'm Dr. Tara, and this is Hopeful Hints, a podcast where you'll receive quick, hopeful hints on all things women's health and infertility. Here, you will find education, inspiration, and most importantly, find peace and empowerment as you walk through the next steps in your healthcare journey. I'm your host, Dr. Tara Harding, and we are continuing our conversation on thyroid health. Specifically this week, the connection between thyroid and weight, something I see far too often go underlooked and not taken serious in practices across the country, really, as I'm working with patients from all over. So you patients have really had to become your own medical advocates and know probably more about medical topics and terms more than you even want to know, but let's dive in. So weight fluctuation is a common concern. I just want to validate that. Like, it doesn't matter if it's 5 pounds, 10 pounds, 50 pounds, 100 pounds. If you're concerned about it and it is from your baseline end of it, you're concerned about it, something has changed and shifted hormonally in your body and it deserves to be taken seriously. Whether that individual provider thinks so or not, you are with your body 24/7 and it's a concern for you. So, the thyroid gland holds really a key insight into many issues, and weight is one of them. And understanding that connection is essential because we know that thyroid issues impact millions in the country. And so optimizing your thyroid, it might be what's considered in a normal range, but it's high end. And we need to optimize that thyroid for you so we can assist with weight issues and the weight gain that you've had. Or perhaps you're losing weight and have no idea why, and it's hyper. So again, it gets overlooked, but we need to just talk about it today so you can advocate for yourself. So take a look at the role that it plays. So the thyroid gland, we talked a little bit about this last week, produces hormones that help with our metabolism. And this is where your body is converting what you eat and drink into energy. And that's the role that the thyroid helps with when it comes to weight. So T4, T3, they help regulate the speed and efficiency of your overall metabolic process in your body. And when the thyroid releases, it has to be just the right amount of hormone, then your body metabolism functions optimally and maintains a balanced weight and energy. So key is energy with the weight part too. How are you feeling? You dragging throughout the day? We need to look at thyroid and optimizing that. When there's a small deviation in this hormone production, we can have weight gain and or weight loss, and we have metabolic changes going on. So again, it's a sign. You either losing or gaining, and being stuck in this is your body saying, hello, red flag here, we got something going on. So hypothyroid is again that underactive, where the thyroid does not produce enough hormone. It slows down the hormone production, decreases your metabolism, and then we usually see the end result of weight gain. And weight gain is usually not solely from fat accumulation, but it can be from excess salt and water retention. A big question I ask in my practice is, do you have any swelling or puffiness to extremities? And that kind of thing. And individuals, typically we find some thyroid antibodies elevated or other TSH and other things wrong. So individuals with hypothyroidism might just simply find that losing weight became more challenging out of nowhere. And we have to look at, no wonder why, because your thyroid is off and your metabolic rate, you're tired, and other symptoms. So let's look at other symptoms besides weight gain. And that's that fatigue, tired, cold intolerance, like you're cold all the time. Dry skin. Yes, it's winter time, but like, has this been going on longer? Is it more than normal? Hair loss, hair shedding, hair thinning, your heart rate being kind of slow, that kind of thing too. We have smartwatches nowadays where we can kind of look at the cardiac factor of this more too from our wrist. Maintaining weight. So if you have hypothyroidism, maintaining it too. And we have to look at perhaps bringing in some therapy to optimize this and alleviate some of those symptoms, get your weight more under control along with everything else, right? Like you're probably doing already the dietary, the activity, and it's just not working for you, or you're so tired you can't get yourself to do that. So we need to really look at optimizing your thyroid for that as well. Now, hyper is usually when that thyroid is overactive and produces too much. And so therefore you have an accelerated or increased metabolism. And this might be that weight loss. Like, what is going on? I'm eating everything under the sun and I'm not gaining it. I'm in fact losing it, or you're not gaining it at all. And so this is actually unhealthy. Many would be like, oh, that'd be great. No, it's not healthy overall for your system to be running that high all the time. We then sometimes see muscle weakness, fatigue with that too. And we have to think about bone health. We worry about osteoporosis if that's left ongoing for too long. So some other symptoms to look at is rapid heartbeat with that, increased appetite, anxiety, and then heat intolerance often goes along with that too. And so we need to look at it again, reducing that thyroid hormone, having a team approach to this. Do you have to go see an endocrinologist, look at some iodine therapy surgery, along with diet and lifestyle choices too? So let's put this together more. We know that nutrition plays a significant role in thyroid health and weight management. And we are going to talk more about iodine and selenium and zinc, as those are crucial for thyroid. But when we don't have those dials dialed in appropriately for the thyroid too, no matter what you do, is going to backfire more times than not. So we have to really dial in on these hormones too and understand that there is things you can do. Let's talk about iodine. So both deficiencies and excessive iodine can cause thyroid problems. Selenium and zinc I talk about a lot in my practice, but what those do is really help with that conversion of T4 to active T3 and then maintaining just overall really good thyroid health. Certain foods like soy, broccoli, cabbage have a component in them that can actually interfere with thyroid hormone production, mostly when you're consuming them in high amounts. So as long as you're just doing those in moderation, it's fine. And really spacing everything like you should be anyway from your thyroid medications. If you're on that, you're safe to go. My little tip for my thyroid patients is keeping that medication on your nightstand beside your bed. So at the moment you sit on the side of your bed or in the bathroom by all your stuff when you're getting ready in the morning, you take it so it's separated far enough away from everything else that you're about to intake for the day. But managing weight when dealing with thyroid can really just be challenging. It's not impossible. We just have to get the right team together to approach this with you and ensure you're on the right type of medication, the right dose. Are you having side effects that are being overlooked if you are on that? And then really dealing with the psychological impact. Again, I don't think we talk about that enough, but it really is significant and it really affects our self-esteem, our body image, overall quality of life every day. Like the moment you wake up, the moment you go to bed, that little thyroid can have an impact on so many things. So again, just really addressing and acknowledging that there is psychological aspects that go along with your thyroid is important, and finding a healthcare provider who takes your concerns seriously and understands it, not just checking your TSH or maybe one or two more labs if you're lucky and saying you're normal is really important too. There's, of course, support groups out there. We do have some mental health components, getting you in with counseling and therapy and really just, again, creating that team approach. But we have to understand that the thyroid gland is very pivotal to regulating your metabolism and your weight. And these disorders can cause weight issues. And understanding that connection is just really important. But understand that with the appropriate medical team treatment, some lifestyle adjustments, and dietary changes, we can really help optimize that thyroid so you're feeling better. Thank you so much for listening to this week's episode of Hopeful Hints. We'll see you back here next week.